Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist. Today we're going to talk about coronary stents, blood thinners, anticipated surgery, and side effects of these blood thinners. Anytime someone gets a coronary stent, as it is shown in this picture, we are putting in a metal wire mesh which is going to stay in the coronary arteries permanently. And in order to prevent the platelets from sticking to the stent and creating a new blockage, we use blood thinners. The most commonly used blood thinners are aspirin, Plavix, Eliquis, and similar drugs. What do these blood thinners do? When we put a foreign body in the coronary artery, a drug-eluting stent or a bare metal stent, there is a tendency for these platelets, the little small cells which form a plug whenever there's bleeding. So these platelets stick together and they try to block the artery lumen. In order to prevent that, we use a combination of aspirin plus Plavix or aspirin plus Eliquis. Aspirin will be taken by every patient. Then a choice will be between Plavix, Eliquis, or another drug that is determined by your cardiologist. Once you get a stent and you're going to be on this drug for a minimum of 1 year if you have a drug-eluting stent, and for a minimum of 3 months if you have a bare metal stent. There are risks associated with these blood thinners, and we're going to talk about those. Before I talk about the risks of blood thinners, let me explain to you what do these drugs, aspirin and clopidogrel or Plavix as it is called. You need to get familiar with both the names. The generic is clopidogrel and the trade name is Plavix. These block the function of the platelets, the little small irregular cells in the blood that stick together in a fibrin network to form a clot that prevents the bleeding. However, they act on two different receptors on the platelets and completely neutralize their effect. As a result, the platelets no longer stick together. As a result, your blood is pretty thin as far as bleeding is concerned, and that's where your role comes in, preventing any bleeding of any sort from trauma, etc. As I said, these platelets are made ineffective for the rest of their life, which usually is from 5 to 7 days. And as the new platelets are formed, the drug will continue to block those platelets. And so there is always a risk of bleeding from any part of, there's a O missing here, part of the body. So if somebody bleeds in the brain, it can lead to a stroke. It's not uncommon for people to bleed in the stomach or the colon. And sometimes there could be blood in the urine. Or sometimes people can bleed in the skin where you're going to get all these brown and blue marks all over the skin. And sometimes you may notice blood in your stools. So these are all signs of bleeding from the antiplatelet agents or clopidogrel and aspirin or Eliquis and aspirin combination. If you don't give the blood thinners, there's a very high chance of getting blood clots within the first year. So it is imperative that you take these blood thinners religiously without ever stopping it unless your cardiologist recommends you to do something otherwise. When you take these blood thinners, there's always a risk of bleeding somewhere in the body. So what do? First of all, you do not stop the medicine by yourself. It is very important for you to make sure you take these medications when you leave the hospital and remember to take them for a minimum of 1 year for a drug-eluting stent and for a minimum of 3 months for a bare metal stent. How long you need to be on the blood thinners? I already told you, 1 year for a drug-eluting stent and 3 months for a bare metal stent. The real question comes up for cardiologists and for the patients is if you need a surgery, what do we need to do? Sometimes you may need a diagnostic test which may involve some kind of a procedure that can cause bleeding, or you may need a surgery. If you need a surgery, if you have a drug-eluting stent, we generally recommend people to postpone that for a minimum of 1 year. Or if they have a bare metal stent, they postpone that for a minimum of 3 months. It is better to be safe than sorry, because after the procedure, if you bleed, now you have two problems. One is the problem you're dealing with, and the second one is the bleeding from the procedure or surgery. So you need to avoid trauma. And if you ever have to stop the medication, you need to consult with your cardiologist. Blood thinners are like a double-edged sword. They help you on one side, but they also carry the risk of bleeding on the other side. So it is a delicate balance of preventing the bleeding and at the same time making sure that you have adequate antiplatelet agents in circulation so that it prevents any clot formation in your coronary arteries. So that is a quick summary of coronary stents, blood thinners, bleeding, side effects, and what if you need surgery. I hope this has given you some insight as to how important it is to make sure that you take these medications and know what are the risks and how you deal with those risks if you do come across a bleeding situation or if you need an urgent surgery. Thank you so much for watching this presentation, and I will see you in the next presentation. We have hundreds of educational videos for the public on heart disease. If you want me to produce a particular video on a certain topic, let me know. I will do the research and produce that video. Thank you so much.